Good morning to all. I am Dr. Nitin Bhatia, representing INTAS Animal Health. I welcome all the veterinarians to this innovative online platform of knowledge sharing. As you are well aware that our last webinar on augmenting animal reproduction and its efficiency by Dr. Nitin Markandeya received an overwhelming response from all of you. And we are pleased to bring forth yet another topic of your practical interest and demand in the current times, that is heat stress, fluid loss, its restoration in animals. If you look at the last webinar that we conducted, we had around 2,300 veterinarians from across the country. Today, our current presence is 2,200. Currently, what we can see, and many more would be joining us for the webinar. At the outset, we thank all the veterinarians for their dedicated service to the profession during these tough times of COVID. We have observed that during the lockdown 1 and 2, many veterinarians were extending their services and treating the ill animals when the entire country was in a shutdown. We wish all the veterinarians good health and great professional success. We all know that summer is practically approached in good number of states of the country. We thought it is worthwhile to talk on a topic of current interest. So our topic for today is heat stress, fluid loss, its clinical diagnosis. For this webinar and its deliberations, we have Dr. G. Vijay Kumar, Professor and Head, Department of Veterinary Clinical Medicine, UTRC, Namakkal, that is from TANUVAS campus. If I have to say about Vijay is a doctorate in veterinary medicine and a postgraduate diploma holder in clinical and emergency medicine. His area of expertise includes ruminant medicine, veterinary clinical medicine, internal medicine, and he has expertise on the areas of ultrasonography, clinical care, critical care, cardiology, and endoscopy. Dr. Vijay is, of course, an epitome of knowledge, an eminent veterinarian, and of course, a great human being. He has been a guiding force and a mentor for many veterinarians for their career and its enhancement. He has to his credit more than 110 clinical articles as a main author and more than 40 articles as a co-author. He has published 5 books, guided postgraduate and doctorate students, and as well as also undertaken diploma courses in endoscopy at TANUVAS. Since his times of graduation, he has been honored with number of awards. His graduation started with Bruno Memorial Award down there in 1994. He received the TANUVAS Merit Award for his post-graduation and then CSIR Fellowship Award for his PhD. He's an INTAS and ISVM Young Scientist Award winner for 2002 for his PhD work. He has also had number of awards for his best publications. He is also a young scientist by DST. TANUVAS has recognized him as a best clinician in 2012. Last year, we saw him receiving the ISVM Gold Medal for outstanding contribution in clinical and canine medicine. So we all join, and I take the privilege of welcoming Dr. Vijay Kumar to this virtual screen. It is my privilege to have you here, sir. We also look for your expertise and knowledge sharing on heat stress, fluid loss, and its restoration. Before I hand over the screen to Dr. Vijay, let me remind all the veterinarians that you're watching a video. To the right of the video, you have a comment box and a question answer box. You can type in your questions anytime during the session. Many people have already done it. You can do that now also till the session ends. And once the session has ended, we will take your question answers. Dr. Vijay will try to attend on to your questions, but we would be having 20 to 30 minutes for the question answer series, and we'll try to attend the best possible. Over to Dr. Vijay Kumar for his deliberation. Dr. Vijay, the screen is yours now.
Yeah. Thank you, Dr. Nitin. And at the outset, I thank INTAS for taking a very good initiative And this is an open platform where we can meet veterans. And I should congratulate all the vets because large animal practitioners is going down. So only by these type of webinars and constant training program, large animal field practitioners should be increased. So going on to this the topic, beautiful topic has been coined by INTAS and its company, especially Dr. Nitin. It's a heat stress, fluid loss, and is a restoration in animals. So coming on to the learning objectives, now we'll see we have broken into few topics so that it will be easy for our understanding and discussion. And we are going to cover on heat stress, fluid distribution, process of fluid imbalances, maybe the disorders and diseases. Okay, so we have classified this into a few broad topics where we are going to see heat stress, fluid distribution, and process of fluid imbalances, assessing dehydration and restoration of the temperature. Now at the outset, we'll just see what are the functions of the water in a body. It eliminates the waste products. The most important is regulate the osmotic blood pressure as a tool for transport for the milk and saliva, transfer the nutrients and hormones. Most importantly is to regulate the body temperature. You may have a doubt what is the quantity of fluid or the water requirement for a day by a cattle. This chart roughly gives the gallons of water taken by an animal. Let us take an example, what I put in a green color. Dairy cattle takes about 15 to 30 gallons of water. So you can understand what is the importance of water in an animal. It is not that just water is taken based upon the dry matter. It is the other factors which are also considered for water requirements are milk yield, the quantum of sodium in the diet, and of course the temperatures. All these are being taken into account for your the calculation of the water requirement by the animal. So that is recommended by NRC. So coming on to the subject proper. So it is the heat stress. What is an heat stress? At a point, the animal is not able to designate adequate quantity of heat so as to maintain the normal body temperature. Let us see, there are 4 ways by which the heat is exchanged, whether it is a human or any body surface or an animal. It is a radiation, conduction, convection, and evaporation. As you see in this animal, the animal takes up the heat from the sunlight or by means of radiation, keeps on heating and continues to dissipate the heat produced in the animal or what it absorbed from the environment. It dissipates the environment by conduction, by physical contact, convection by movement of the air, and of course through evaporation of water by panting and sweating. This is what happens in a normal animal. Now what happens is these worst factors, for example, abnormal or sudden rise in temperature. Temperature here means not the body temperature, it's the environmental temperature. And continued high temperature on any given day, wide difference in the day and night, and added to that is a high humidity. This makes it worse. The animal keeps on, it gets heated up. There is a little amount of evaporation through your respiration. Conduction and convection is reduced. The evaporation keeps on sweating. As a result, the animal loses a fluid. There is a salivation through which the bicarbonate is also lost and dehydrated. And it comes to a status where the animal is not able to dissipate the heat and it goes for a heat stroke. So what is the criteria? It is not only the temperature, the humidity is also taken into account. We call it as a temperature humidity index. So don't bother about the formula, but it is an expression what it is, including a dry bulb and wet bulb. Okay. So when this temperature humidity index is higher than 72, definitely the cattle is prone for heat stroke. So it is our importance to keep the animal well below the 72. Now you can see that blue color, all these animals would be safe and it is not on heat stress. Once it crosses the 72, it will be going into heat stress. Finally, it will go for heat stroke and then coma and death. So what are the direct effects of the heat stress? Because of the increase in the environmental temperature and humidity, there is reduction in the feed intake, physiological processes are being affected, changes in the behavioral expression, metabolic changes, and of course reduction in the immune status. So you can see there is high ambient temperature added to that with the increase in the humidity. So animal pants, increase in the perspiration, drooling of saliva. So thereby the saliva is lost or bicarbonate is lost. The net bicarbonate which is need to go into the rumen for buffering is also lost, ending up in acidosis. The total quantity of feed intake is reduced, and hence the milk reduction is there. And buffering capacity because of panting, carbon dioxide lost. Ultimately, the total production by the animal is reduced. So these are the indications which helps us to understand what is the impact on the animal. Now you can see roughly animal 0.23 kg per day of feed is reduced. The milk production decreases by 1 kg for every degree in rise in temperature. Roughly 2% loss of milk production because of the heat. If we see the hot and humid season, there is about 50% reduction. And most is the higher level of production. Those who are producing high milk yield are the worst affected. The worst scenario is experienced by buffaloes because buffalo have only 1/6 of the sweat glands what a cattle have. Cattle is the white cat. And when coming on to the heat or the perspiration or the sweating, the most sweating is the horse, followed by man, and then cat. Then you can think 1/6 is buffalo, and hence it is worst affected. And moreover, buffalo are black-skinned. You can understand black or favorable. They absorb the heat. That is why buffaloes are more prone for the disorders because caused by the heat. There is a decrease in the milk yield, growth, and fertility. That is why the silent heat and poor expression is more common in buffaloes, especially during the summer season. Now you can ask what are the clinical manifestations of an heat stress or heat stroke. Salivation, rapid and shallow respiration. Some animals goes for a coma, depressed, goes in a lateral recumbency, protruded tongue, pupil is dilated, and the animal is literally hard to touch. Now, those who have already seen this animal will agree with me. If you introduce the hand in the rectum, as if you have introduced into some burner, it's like burning up internally. This is the worst situation. So now you can understand how much the stress is on the animal. So this is other way of explaining what is the untoward effects and ultimately leading to on to death. There is increase in the metabolic state with increased oxygen consumption, disseminated intravascular coagulation. As the temperature gets increased, cerebral and cardiac functions are affected. GI, there is a desquamation, endotoxin absorption leading on to bleeding diathesis. Ultimately, skeletal muscle weakness, animal goes for acidosis, coma, and death. So this is the animal which is standing, gasping, and then goes for recumbency. So what are the strategies we are supposed to take it up? The main is the management. We will be seeing in subsequent slides. As a veterinarian, when these animals are brought, what is the first you are supposed to do? Don't try any NSAIDs because NSAIDs does not have any role in heat stroke. Because the animal is in a state where there is no gradient. It cannot dissipate the heat to the environment and the thermostatic mechanism is not functioning. So only possibility is by your fluid therapy and your physical methods of cooling the animal. So fluid therapy you can pump in as per the requirement which we are going to see in the subsequent slide. IV fluid and then roughly about 5 to 10 liters of fluid. If possible, you can give cold enema or rumen lavage with the water and provide ample quantity of water if the animal is taking. So that is the strategies which as a veterinarian you can do it. So coming on to the environmental modification, you can provide with the shades. Shades you can give with the tree shade is the best, or you can go for artificial shelters, ventilation, wetting the animal, providing mist. The most important is provide antioxidants, vitamin E, A, and the niacin and biotin, of course, for the energy. Now the trees you can go for the neem tree or Pongamia because these are the one which gives out more amount of oxygen. So tree shades are best. And it is necessary you provide some amount of misters or sprinklers where you have in the farm setup. If you have a very individual animals, you can go with a fan. I have seen in a farm where they give 1 to 2 fans per animal or 2 animals. 3 fans are shared by 2 animals. So that is more important. The idea is to increase the physical methods of cooling when the wind flow at 5 km per hour is considered. And then you can have sprinklers. The sprinklers are wonderful. If you do not have the sprinklers, you can take a hose pipe and then connect it to a tap water and then pour it on the animal. Literally, that is what you can do it. Provide ample amount of water always available to the animal. If there is a wallowing, very good for buffaloes, the cattle, or just by sprinkling the animals. Don't forget to give salt licks because potassium is going to be lost and then bicarbonate is going to be lost. This is more important. And then you can provide, as we said, the supplements like vitamin E and selenium. Nice. This is how we are going to tackle your heat stress. More important is pumping the fluid and physical methods of cooling. Okay, so that is the most important. Now the second part of it, we are going to go for fluid distribution in the body. If you have some paper and a pen, please jot down so that it may be useful for you to follow it up. So coming on to the fluid distribution of the total body weight, so we have what 60% is the water and 40% is others. Of the 60%, 40% is intracellular fluid and 20% is extracellular fluid. So in the 20%, 50% is interstitial fluid, 1% is transcellular fluid. Please understand we are going to concentrate on this, what is called a 5%, because through this only we can enter into the animal. All other compartments are not approachable. So the plasma, otherwise it is the blood system or the intravascular component. To simply express in the case of a large animal, it is our jugular vein. So to put in a nutshell, 60% water, so it is the 1/3, and 1/4 of VCF is plasma. To make it a 1/3 into 1/4 is 1/12. So please understand this 1/3, 1/4, and making up 1/12 is needed once you calculate the total fluid deficit to arrive at the plasma requirement of the animal. Okay, so this is more important. Please jot down. Coming on to the take-home points. So this is a recap. ECF 1/3, plasma 1/4, making up 1/12. Now, how to calculate the fluid requirement in animal? So 3 components. One is the replacement, maintenance, and production requirement. Replacement is the total amount of fluid that is being lost. That is calculated by a formula. We will see in the next slide. Maintenance is 50 ml per kg body weight. Coming on to the production, how much amount of milk is produced. That we will see in the subsequent slide. So going on to the capillary refill time, you just take into the slide. Press the gum and then continue to look at the gums and count it as 1001, 1002, and 1003 to know the capillary refill time. You don't use your wristwatch to calculate the capillary refill time. What will happen? You will get a spondylosis. So what happens is press the gum and then blanch the mucous membrane, continue as 1001 and 1002. Maybe this is less than 2 seconds, the capillary refill time. So don't use your sports watch or other watch. This is the best way to calculate. If you are able to calculate, that is the best. But it is difficult to take in those animals which is pigmented. So other ways of assessing the dehydration is your skin turgor test, mucous membrane, as well as the moistness. Okay, this is a table. I'll go a little bit fast because this is going to be given in the notes or is available in any other standard book. Less than 5% is not available. It is not deductible clinically. 5 to 6%, there is subtle loss in skin elasticity. That is, you pull the skin and take the time taken for the skin to regain the original position. That is called skin turgor test. 6 to 8%, there is increased, and there is a pink sticky mucous membrane, increase in the CRT. 8 to 10%, enophthalmos is most, and dry mucous membrane. And 10 to 12%, marked enophthalmos, mucous membrane becomes dry. 12 to 50%, it is almost in the shock state, moribund, death is imminent. Kindly note down what is on the right side is the clinical sign, left side is the percentage. Why this is needed? Because clinicians are going to encounter the clinical signs. By seeing the clinical signs, see the percentage. Because by this percentage, we'll be able to calculate the total fluid required for an animal. So you just see it the coming slides. In case of calves, please take into the eyeball because it goes for an ophthalmos, depression, sunken eyeballs, and skin tenting test and the mucous membrane. Okay, so the eyeball goes depressed. How much it goes depressed? This is an additional chart which helps us to score the dehydration in case of calves. Now you take down, this is in a formula, fluid deficit in liters in case of large animal is percentage of dehydration into body weight. Now you will understand why we have seen the chart with the clinical signs. By seeing the clinical signs, you can substitute in the formula what is the percentage. Okay. We will just see and understand when you take an example. Example, calculate the fluid deficit in a cow with 360 kg body weight and 10% dehydrated. So it's a formula, is percentage of dehydration into body weight. Substitute this 10 here and the body weight here you get into 36 liters. This is the total fluid deficit. Now you substitute in the distribution of water, total deficit is 36 liters, ECF is 1/3, 12 liters, and then coming on to plasma is 1/4 of ECF, it's a 3 liters. Okay. So now what is important? Why this fractioning is being done? So this is because plasma is lost, is already lost. So we can pump in these 3 liters into the intravenous. So you can pump using a pump, literally you can pump in because this is already lost. Remaining part you have to wait. That is the ECF. So remaining part, so you can see the 9 liters you can give over a period of 6 hours. The remaining 24 liters you can give over a period of 12 to 24 hours. This is how is important. You calculate the total fluid deficit, directly 1/12 is the plasma. So you pump in immediately, the remaining you can give it for over a period of time. That is why I asked you to go for the fractionation. And in case of acute, you are going to pump in very quickly. In case of chronic, you can take little amount of time addition. So that is as far as the total fluid requirement is concerned. Now coming on to the body weight. Why the calculation of body weight is important? Because either the fluid or the antibiotic is based upon the body weight. You can use the formula. The formula is easy. Everyone knows it. So all the others are based upon this Schaeffer's formula. So length is from the point of shoulder to the buttocks, and girth is just around the girth in against in inches. Now you've got many applications available for your Android. Many things are available. You can go into Google Play and then download this feed calculator. Many applications are there. One easy I am telling. Once you download, so what happened? A screen like this comes. You can measure the length and then pull on this pink color dot, scroll it, that will give it in inches, and then take the girth and again scroll this girth into so many inches. It instantaneously gives the body weight. So from this body weight, you can substitute in the formula. This is when you are using the app in Android phone, other things. Otherwise, there is a ready-made weighing tape is available. As soon as you measure the girth, the tape gives the body weight. So this tape is also available. You can get from the shop. So these are immediately after measuring, you will get the body weight. That over a period of time, if you want, you can measure it in the weighing balance and check whether these things are really giving the assessment of the body weight by tape or by Android or by means of Schaeffer's. Now take home point, additional requirement. This is what I told. Each liter of milk requires approximately 1 liter of water. And if the body temperature is what we are given as a normal, now for every increase, 1 degree increase, we need additional of 4.5 liters of water over and above the basic requirement. So this is as far as the production is included. So this you have to add along with the maintenance requirement. Okay. So now we will consider by taking an example of a cow. with a temperature of 103 and milk yield of 5 liters. Okay, so elevated temperature, it is only 1 degree. So you have to take 5 liters. 5 liters is added. Milk production, 1 liter is needed for every liter of milk. The given is 5 liters, so this becomes 5. So 5 plus 5 becomes 10. Kindly include this 10 liters while you are calculating the fluid requirement, considering the daily requirement as well as the last, based upon the dehydration. Now, this is what I tell, the replacement based upon now percentage of dehydration on clinical signs. Maintenance is based on 50 ml per kg, and production requirement, just now we have seen how much milk is being produced. Now we'll slowly go into the conditions which are causing losses of the fluid. The first and foremost is the heat stress, what you have seen, and the GI tract disorders, maybe diarrhea, abominable displacement, choke, intestinal obstruction, lactobacillosis, alkalosis, or systemic conditions, maybe septicemia, toxemia, mastitis, preferably coliform mastitis, many conditions which causes the fluid loss. Coming on to the fluid therapy in adult, so we will see the most, this is especially in case of adult or mature cat. The dehydration is not overhead shock, and you have got a sign, the animal will exhibit the signs, and during that you can pick up. And most of the time it is a negative base excess, and it is most likely to be this alkalotic, except in few conditions like rheumatic acidosis as well as diarrhea. Please consider chlorine, hypochloremic, hyperkalemic, and also calcium. So these three things should always be in your mind whenever you are treating the fluid therapy in cat. Hypochloremic, hypokalemic, and hypocalcium. What are the routes of fluid administration we have for cattle? We have got oral route, another is IV route or parenteral route. Oral route is cheaper, and when the rumen can accommodate, okay, so when it is so bulky, it can accommodate, you can go for oral route, and it is a cheaper because the fluids are just mixing with the available water, and then you can give it. Hypertronic solution can be safely given by oral route. For example, you want to give potassium chloride, you can mix it and then you safely administer. When considered to the IV potassium, it is has to be administered slowly and risky. Then the other route available for us, which is favorable in case of a heat stroke or in a shock, is your parenteral. And then the advantage is it can be easily given in neonates because it directly goes for a shock and more practical. Coming on to oral restoration of fluids in cattle, if pump, you can use a pump. There are many pumps available. The advantage of using pump is that now you can see a bucket which is about 25 liters. We can pump within 2 minutes. So that advantage is the rapid fluid administration using a pump. And this is a small pump which you can, if it is available, use it. Otherwise, you can use with a regular. Now these are the composition of ORS. Main component: sodium chloride, potassium chloride, calcium chloride, and of course propylene glycol as energy goes. Mix it in 20 liters of water and then give us a oral restoration solution for cat. And then if it is an impaction, take magnesium oxide 500 grams, mix it in 5 liters and then give it in the animal. And you can see this is the excreta, or what is the dung obtained in a cattle like this. After oral restoration solution with the magnesium oxide, the dung is improved like this. Now coming on to the oral restoration solution in case of a cough, if it is less than 8%, dehydration is less than 8%, you can go with oral. If it is more than 8%, definitely you have to go with IV fluids. So the common is 2.5 grams sodium chloride, 1.5 gram potassium chloride, 5 grams sodium acetate, and then 28 grams dextrose, and give it in the case of cough. Make it 2 liters. So give it, don't give more than 2 liters because it is bulky and there may be a reflex. So get divided and then you can give over 3 to 4 times a day in case of a cough. Then preparation for a recombinant cow. Actually, it is a recombinant cow, but this downer cow is being used as a misnomer because whatever cow that becomes recombinant, we call it as a downer cow. Take into consideration it's a milk fever, but it is restricted to the animal which has been treated for a milk fever 2 times and not able to get up. That is called the recombinant downer cow. All other cattle are recombinant cow. So what is the speciality in recombinant oral restoration solution? It is the potassium chloride. Potassium is the culprit which is responsible for the continued recumbency in recombinant cow. Now this the thing is also available that you can use it very good for restoration preparation. Don't go for a human product. So take it for a veterinary product or the composition which has been given, that you can easily use it for oral restoration therapy. Coming on to the other part is a parenteral therapy, for which there are many routes are available, intraperitoneal or subcutaneous or intravenous. For us, intravenous is the best, so we can use it. So there are different types of fluids available. We call it as crystalloids and colloids. Don't get confused. It's very simple if you follow this. What is crystalloid? Crystalloid is nothing but they are small particles that can easily go into the bloodstream and ultimately reaches the cells. So of the crystalloid, we have got different types based on it is isotonic or hypertonic or hypertonic. So what is isotonic? Isotonic are those solutions where its composition is 280 to 300 milliosmoles per liter. So it is in the, once you administer, it will be in the blood. Neither it goes inside into the cells or outside. Inside in the cells, that is the RBCs. Does not cause the rupture and does not cause it to shrink. So this is why we are using these isotonic solutions to increase the circulating volume and the fluid. What are your isotonic solutions? All these routinely comes in our mind are isotonic solutions. Normal saline, Ringer's solutions, Ringer's lactate, dextrose normal solution. All these are your isotonic solutions. Then there are also solutions which is called hypertonic, 0.45% and then 5% dextrose. Dextrose initially it is this like this. Once it gets metabolized, then it becomes isotonic. That's why I included in this. And we very rarely use this hypotonic solution unless it is a diabetes or renal problem. We don't get these type of conditions in our cases routinely. Hypertonic, yes, this we are going to routinely use because 10% dextrose or 20% dextrose or protein hydrolyzate, these are going to be used. Or 5% sodium bicarbonate or 7.5% sodium bicarbonate or calcium. These are hypertonic because these are going to be more than 300 milliosmoles per liter. So to put in a nutshell, isotonic is very simple. It's 280 to 300, and hypertonic is more than that. So so far we have seen as a crystalloids. Crystalloids are to be used for this entering into this blood vessel. What are colloids? Colloids these are the large molecules. They are called as plasma expanders. They'll be a large molecule, so keep the water molecules, retain it, so it helps to maintain the plasma volume. So whatever you administer, for example, crystalloid, it gets redistributed to the various compartments and ultimately reaches the cells. Okay, so intracellular, it reaches cells. But colloid, it retains because it's a large molecule, osmotic active, so it retains the water, so it maintains the plasma volume. So what are the colloids? There are many preparations available as a colloid. So even your blood or albumin is a colloid. Of the colloid, the blood or hydroxyethyl star are the best colloids available. You also have dextron, ramasil. So these are from the gelatin. So these will slowly move out of the market in a few years because of the side reactions caused by it, amazil as well as the dextron causing worst in the case of a renal problem, and there are many literatures to support that. So you can continue to use hydroxyethyl starch or your blood. Blood, of course, when the packed cell volume is less than 12% or 15%, you can go for a blood transfusion animal and then following a triple drop method. And if it is a valuable progenitor animal, you can go for a blood transfusion because the transfused blood is going to be in the system for about 10 to 15 days. So within that, the animal has to go for the hemopoietic system has to work it out. If the animal can do it, then you can go for a blood transfusion to tide away these 10 to 15 days. Otherwise, you lose the animal and the cost involved in blood transfusion is also large. So you can consider the cost and then go for a blood transfusion in case of anemic animal, provided the animal is a valuable animal. Coming on to the fluid therapy quantity. So we know the formula how to calculate the total fluid requirement or deficit, add on the maintenance requirement and your production requirement. All together forms the fluid requirement, of which 1/12 you can give, that is a plasma requirement, and then go for ECM. Why it is needed? When you are aiming at ECM, extracellular fluid deficit, second day you need not go to treat the animal as far as the fluid therapy is concerned. Because once the ECF deficit is reached, the animal will start taking water by itself. So that is the secret. So always aim at ECF fluid correction. Then you need not visit the animal on second day, unless otherwise the animal is not taking the water. So if there is a problem with maybe a oral ulcers or some problem in esophagitis, so otherwise the animal is taking water, you need not go for fluid therapy on second. Then what is the rate? If it is a routine fluid therapy, you can give it as 10 to 20 ml per kg body weight. And then if it is a shock, 40 to 50 ml per kg body weight. If a very severe case, you can give to 90 ml per kg body weight. All these rules, the rate is for crystalloids. Crystalloids are those which we have been using routinely. I told, isn't it? Your DNS, RL, all these are comes under crystalloids. Colloids, just now we have seen. For colloids, kindly use it at the rate of 5 ml. At the maximum, you can use 10 ml per kg. Okay, so this is always remember crystalloid, then it becomes easy. Routine is 10 ml per kg body weight, and shock you can go up to 90 ml per kg per hour. Then when you consider using the formula, you may wonder how to administer the 36 liters or even the 12 liters to be administered within a short period of time. So we have got a rapid fluid intravenous administration set. With that, with a 14 gauge needle, you can administer the 500 ml of fluid, namely the one sachet can be administered in 1 minute 20 seconds. A normal IV set, which you are routinely using, that 15 drops making of 1 ml, will deliver the 500 ml in 5 to 6 minutes. So that is the advantage. It is rapid intravenous fluid administration set. So with the 14 gauge needle or still a Venflon with a 14 gauge, you can administer the fluid of 500 ml in 1 minute 20 seconds. So thereby saving the time of a veterinarian, variable time in the field. So we can administer the exact requirement of the animal in short period of a time and then go for the other case. Okay. Then whether we can mix the drugs with the fluids, do not mix any drugs with the fluids. Only the fluid with which you can administer is your DNS or normal saline. Preferable is NS. If NS is not available, you can use dextrose normal saline. What is it? Because we'll be using potassium chloride or your trivivate or B complex, so or phosphorus. Okay, maybe many drugs are available. Those drugs which if you want to administer with the fluid, you can use dextrose normal saline or NS. Do not mix with other fluids. Okay, do not mix with Ringer's lactate or Intalide, other things. Okay, you preferably use DN. Now coming on to this you know this is a by the tongue where there is a kernels or the feed available. You know this is a Rheumatic Acidosis. Many of you would have identified. The specific treatment is rumen lavage, and then after lavage you can go for a cut transplantation, maybe with yeast and B complex supplementation. But most important is the fluid therapy. We know the fluid therapy. So and the bicarbonate requirement. Okay. So I am stressing on this Rheumatic Acidosis because many of the problem occurs with the bicarbonate. How to calculate the bicarbonate requirement? So millimole of bicarbonate is equal to 0.3 into body weight into bicarbonate. This is the formula. Okay. So problem is, so to calculate, substitute in the formula, bicarbonate deficit can be estimated only by a blood gas analyzer. So this is available only in established institutes like colleges. Otherwise, if you want to do it in the field condition, you have to use a blood gas analyzer which is of cartridge type. But that also cost 3 lakhs and each cartridge cost about 100 rupees, which is not practically possible. So you use this for minus 10. Okay, for the substitute in the formula minus 10, 0.3 into body weight into minus 10, then we will calculate. Okay, so we'll take an example. Always taking an example will help us to remember for a long period of time. So bicarbonate requirement in 100 kg cat. So you substitute this 100 here, 0.3. Base deficit, since we are not able to calculate in field, we are substituting as minus 10 because this is already is a deficit. That's why you are putting as a minus 10. So substitute, it comes as a minus 300 millimole is the bicarbonate requirement. So the requirement is in millimole, but availability is in percentage, 5% or 7.5% or gram. Many of the dispensary will have 450 gram. So from the gram, you can easily make 5% or 7.5%. 5 gram in 100 ml is 5%. So it is easy to prepare grams or percentage solution. But the difficulty is how to calculate the millimole from the gram. So that is the problem in the field. So for that, you calculate this is a thumb rule or equivalent. Each ml of 7.5% solution will give you 0.89 millimole of bicarbonate. So what is that? Or you rewrite this sentence, 0.89 we need 1 ml. So for 300 millimole is substituting in this simple equation, we get 337 ml of 7.5% sodium bicarbonate. So once you remember this, it is easy. Now we will see how to calculate in 5% solution. Each ml of 5% will supply 0.6 millimole of bicarbonate. So rewriting the sentence, it gives 0.6 millimole we'll get from 1 ml. So for 300 millimole, substitute in this equation, we'll get 500 millimole. Okay, it's a very easy. From this, now you can easily substitute and then do the treatment of ruminant lactose. To understand in a small ruminant, we need to know this also. Calculate the bicarbonate requirement in a goat weighing 10 kg. Okay, so substitute in the formula. Here the only formula change, kindly note down. Previously it is 0.3 for adult cattle. For a small ruminant, it is 0.6. That is the only change in the formula. Please note that it is a 0.6. Now substituting the formula, this is a 10 kg. We are putting as 10, 0.6. Base deficit is minus 10 because we are taking as a stand. So it becomes as a minus 60 millimole. Okay. So now based upon our formula, minus 60 millimole. So 7.5% by the equation we get 67.4 ml of 7.5% solution. If it is a 5% solution, so we need 100 ml. Okay. So now there are many experts in the field, or sometimes we ourselves sometimes claim that we have treated the rumen lactoacidosis by Ringer's lactate. So we justify it scientifically or ethically. We will see by seeing this slide, we will be able to understand whether it is really possible or not. 500 ml of Ringer's lactate will supply only 25 millimole of bicarbonate. So rewriting the sentence, 1 millimole will supply only 0.05 millimole of bicarbonate. So what is that? 60 millimole is the case of our case goat. So we require 1.2 liters. 1.2 liters for how many kg body weight? 10 kg body weight goat. So 10 kg body weight, we have said we can give 10 to 20 ml per kg or 40 ml per kg. So maximum the goat can accommodate is 400 ml. How this 1.2 liters can be given for goat for Ringer's lactate? So if that is the case, if our cattle weighs about 250 to 450 kg, then how many liters of Ringer's lactase is needed? Really, whether we have given so many liters, that is the question we have to answer by ourselves. So scientifically, please understand, if it is a rumen lactoacidosis, acidosis can only be corrected by an alkali. The best alkali available in the market is your bicarbonate, which is readily available. By substituting the formula, you can easily convert the gram or percentage solution into millimole, and we can easily adjust. Hope that is very easy and you will be following it there. Then coming on to an example, first case is the 100 kg body weight. We have seen we require 337 ml of 7.5% bicarbonate. Coming on to B, B is a 10 kg goat. That requires 67 ml of bicarbonate. The problem is when we give sodium bicarbonate, many of you would have experienced this. Also, I experienced when we are attending the ward in our UG stages, second year or third year in the ward. So case B is our goal. When we give sodium bicarbonate, take it in a 50 ml because this is a 67 ml. We take it in a 50 or 60 ml, put on a scalpel inside in the jugular vein and give it. The animal dies. So the treatment diagnosis is rheumatic acidosis. Treatment is soda bicarb, and the route is correct, but animal dies. But whereas cattle A, that is 100 kg animal, if we give, the animal has not died. So what is the reason? The reason is, you should understand, this is a take-home point. You should never exceed 2 millimole of sodium bicarbonate per kg per. So now we will understand in case of A, considering 2 millimole, this is 100 kg body weight, it's a 200 millimole, or else it is a 200 ml per minute. So 200 ml per minute, if you pump in, it is really, you can say 500 ml, it goes in approximately 4 to 5 minutes. So it is not possible. That is why the cattle A is survived. Cattle B, this is a case B where we have got a goat. 2 millimole in 20 kg is a 40 millimole. So 40 ml, you can easily take it in a syringe and pump in. Since it has exceeded this 2 millimole per kg per minute, this goat or small ruminant are died. So take it home point is never administer IV bolus. Taking in a syringe and pumping it, it is called as IV bolus if the body weight is less than 50 kg body. If the body weight is less than 50 kg, kindly administer in a saline, diluted in a saline and then administer. Otherwise, the animal will end in a fatality. Next type of solution is now hypertonic saline solution. This is very important in field condition. So please take it down. Any toxemia or septicemia or even a coliform mastitis. The most important is your fluid therapy. Okay, in addition to taking care of the udder, the most important is the shock. So you take this hypertonic saline solution, you can prepare. So 3 to 7.5% solution and then administer the rate of 3 to 5 ml per kg IV. So after administering, don't forget to administer isotonic saline or your crystalloids. You can use crystalloids, you can give. Okay, so this helps us to draw the fluid from the system intravascular, thereby shock is avoided or if the animal will recover from the shock. So to maintain it, so kindly give the crystalloids. So whenever you use hypertonic saline solution, after giving hypertonic saline solution, please give crystalloids. Okay. Now that we have completed the how to calculate the fluid deficit and the heat stress. Now coming on to the various acid-base imbalances that may be encountered in a routine field practice. We will first comes the disease, and this one is the what is the abnormality that you can see, and third one is the treatment. Okay, like that I have given as a 3 component. First one is the disease, second is the what is the change, acidosis or alkalosis, and the third one is the treatment. Let us see one by one. Rheumatic acidosis or urinary tract disease, small intestine strangulation or obstruction or a choke. The problem is acidosis, so low sodium bicarbonate and is a dehydration. Kindly correct it with sodium bicarbonate as we have done earlier, now in the previous formula, and followed by electrolytes. Next disease is the cough diarrhea. Again, it is acidosis. Cough diarrhea, always substitute with bicarbonate. Okay, mixture of isotonic saline and isotonic bicarbonate, and give the dextrose also for energy. Isotonic sodium bicarbonate. So far we have seen as a hypertonic, 7.5% or 5%. So for the cough, how to calculate isotonic? Isotonic sodium bicarbonate is very simple. 1.3% is isotonic. 1.3% of sodium bicarbonate is isotonic. Very simple. You take 15.5 ampules, that is 155 ml. In 845 ml of water is isotonic. Then this you can substitute. Okay, so you can give isotonic sodium bicarbonate like this. Then always consider for calculating the bicarbonate deficit in case of coughs. So less than 1 week, 10 or 15. More than 1 week, it is 15 to 20. This is what you are supposed to substitute in the formula for calculating the bicarbonate deficit. Okay. What are the other acid-base imbalances? The displacement of abomasum, impaction, torsion, vagal indigestion, cecal displacement, torsion. The problem is metabolic alkalosis, reduction in chlorine, and dehydration. Balanced electrolytes, Ringer's lactate, and then kindly substitute potassium chloride, which is already also available in Ringer's lactate, but that is by solutions. If it is intestinal obstruction, again a metabolic alkalosis with loss of chlorine and potassium, balanced electrolyte, maybe Intalite, Ringer's lactate, normal saline along with potassium. If it is a diffuse peritonitis, it's a dehydration, then substitute with a balanced electrolyte in large quantities. Mastitis, if a simple with the dehydration, so you can go with a balanced electrolyte. So we have seen the different type of fluids available, crystalloids, colloids, isotonic, hypertonic, other solutions available. The only deviant is your alkalosis or what is called as a putrefaction, where you need to give acidic solution. Vinegar, you can give it oral vinegar, 2.5% or 5%. So those you can drench it. Never give it as such. Kindly put on a stomach tube or Roman tube and then pump in, because mild amount of irritant will be there for the oral cavity as well as use effects. Always put a stomach tube and give, because quantity is more, and then there will be a aspiration pneumonia. So that you always do it. This is the only difference as far as the fluid therapy is concerned, where we give vinegar. Coming on to the ketosis, so we give, this is again a hypertonic 20% solution you can give. Along with that, you can also give, there are many preparations available in the market so that you can use it. Isofluperidone can also be given, but why I have given isofluperidone in a red color, whenever you go for a treatment of a ketosis, having diagnosis of ketosis and then giving a D20 isofluperidone, or you can also give with insulin and dextrose. Okay, so that also can be tried. But what is the why I am stressing repeatedly is, after giving this with the isofluperidone, please advise the owner. The animal may go for a recumbency. If such is the case, please call. Why? Because the isofluperidone causes hypokalemia. Okay, that is, it becomes hypokalemia causes recumbency. So that is why you should always give a cautionary note to the owner whenever you are treating it with a isofluperidone for ketosis. So not all cases should become recommend. Some cases can become recommend. That is why I advise the owner, if the animal becomes recommend, please call me. Otherwise, he is going to call another doctor. Then back to square one, and he will think it is a milk fever, peritonitis, and they again start all get confusion. So you always explain the owner. Then if that is the case, the owner is going to call you. Then you can easily understand that this is because of isofluperidone, and then you can treat it with potassium. And this is another one. This is typical of your hyperkalemia, S-shaped curvature. More severe will be here, your S-shaped curvature in the neck also. So what is how to treat hyperkalemia? Supplement potassium. It is available as a 10 ml ampule. Okay, it is available as a 10 ml ampule. Please give it very slowly, as you are going to give for calcium. So what is the rate? It can be done by Scott's sliding scale rule, which you will be seeing here. Okay, this is the S-shaped neck, and this is the rate we are supposed to give at rate of 0.5 milli equivalent per kg per hour. So this is the Scott's sliding rule. If you are now able to understand what is the serum concentration, so what is the milli equivalent of potassium we can add to per 500 ml of solution, and what is the rate. So this may be looking confusing in the field. I will tell a simple thing to follow it in the field. If you come across like this, you can take 3 ampules. Each ampule is a 10 ml. 3 ampule in 500 ml of normal saline. Don't exceed 3 ampule per 500 ml of normal saline, and then give it slowly. Each animal may roughly require about 15 to 20 ampules. So naturally, 15 to 20 ampules, you can use so many amount of normal saline sachets and then give slowly. And at the end of the things, then you can lift the animal. You are surprised, the animal which was brought recommend, it will stand up and go by one. Okay. So the hypokalemia, is more important. Please advise after your ketosis. Then there can also be animal can be recommended after rheumatic acidosis treatment. This is because sodium bicarbonate also can cause this one potassium tribe. When you are going to, please give this message also. Whenever you're going for treatment of rheumatic acidosis, please tell him the animal can become recommend. So if that is the case, this is also because of your hyperkalemia, because sodium bicarbonate dries away potassium, causing hyperkalemia. So this is a beautiful L-shaped curve, and that you can appreciate. And there are many people who have applied iodine ointment or tied a rope here, one side, another side, and then started pulling on either side to correct it. So this is because of the animal extreme weakness. So there is a S-shaped bending, and animal chin will be touching the ground. That is another worst case. Kindly use the Scott's sliding scale rule for administration of your potassium. Then again, when you want to give infusion of dextrose, people say we don't have time, so you push the dextrose into IV. Please remember, whenever you give a rapid infusion of dextrose, that causes hypophosphatemia. Okay, so whenever you go treatment for a dextrose, please understand that it can cause hypophosphatemia and then other consequent results. Either you supplement phosphorus, okay, or you remember that it can go for hypophosphatemia and give a note to the one. Okay, so these are the few the take-home lessons you have to note down whenever you treat for ketosis. Rapid infusion will cause hypophosphatemia. Okay, so that I have completed these things, and then we are waiting for Dr. Nitin.
Thank you, Vijay, for a very elaborative session on fluid therapy. I hope the session and Dr. Vijay has not led to Sunday stress or heat stress to all of you. It is actually a very relevant topic. We can look at the questions and understand that there is a lot of unclarity amongst our own colleagues as to what fluid to be used when. So there are a number of questions. Let me say that we are currently having a attendance of 2,950 vets attending this program, out of which around 1,300 have posed queries.
Oh,
it's a very big number. But a major query is, in what condition I use what? When do I use a DNS? When do I use a RL? When do I use a Interlight? This is the basic query which is coming from most of the people. Dextrose, 5 or 10? RL and
the individual disease.
20%.
Correct. In the individual disease wise, I have given you about the mixture of electrolytes. Wherever I put as a mixture of electrolytes, balanced electrolyte, you can go with either Interlight or Ringer's lactate. Okay. Wherever is said you have to mix with supplementation, where you can go with the dextrose normal saline. Where you want to give as a vehicle, you can go with a dextrose normal saline. For example, you want to add potassium, you can use that. Okay. So in each disease, I have clarified what is the imbalances that is encountered, metabolic acidosis or alkalosis. Underneath, I have given a balanced electrolyte solution. In that, if it is a balanced electrolyte solution, go with a Ringer's lactate or Interlight. Okay. And I have given supplement with potassium or chloride. In that case, you have to go with normal saline or dextrose normal saline plus potassium. Okay, that if you are going through the slides, it will be clear, sir.
Vijay, the second query, rather request from most of the people is, can we share the presentation on email?
Can we share?
So that is the presentation on email.
PPT. Yeah. We will give
to
Dr. Nitin. Nitin will be giving to you.
Vijay, your voice, I think, needs to be lifted up from your computer.
Is it? I'll check that. We will give this converted into PDF or as such to Dr. Nitin, and he will be sharing the thing to you.
The next broad question of most of the people is there a nutritional relevance to heat stress? Can we reduce heat stress by giving, say, antioxidants, chromium?
Yeah, these preparations or many preparations are available. Please, even INTAS also get. The main thing is antioxidant you have to give. Vitamin E, supplement with vitamin A also, niacin. Many preparations are available, so kindly use that as a component. And the herbal preparations are also available that you can use as a bolus. The more important is prevention. If the animal is coming, very little effort can be done by a veterinarian to save the animal. By the time the veterinary reaches, you ask the owner to spray the water so that the animal, they say 22.5 times effective if the animal dissipates heat by evaporation. That is, by spraying the water, physical methods of cooling is more effective. That is 22.5 times more better. So you ask the owner to spray water, shift it to a shade, then you can go and pump in fluids. And added to that, this management aspect, kindly give these many preparations as we have for INTAS. So give as a oral supplement to as a preventive.
The next basic question is that can we give IV fluids at whatever frequency we want? Is it not going to lead any troubles to the animal? Because many of formulations they have heard give slow IV. So that is one other basic question which has been asked by around 20-30 people. So I'm not naming down the people because I'm taking questions which are given by more than 20.
Please understand the intravascular component. So that's why I told you just classify, understand ECF and plasma. Plasma is 1/12 of the total fluid deficit. This plasma, you can literally put it in a pump and then put it into IV, animal will not die because that part of the fluid is already lost. So you can pump in. There are yet to design a pump. Maybe you can have a pump. In foreign countries they have, or in human you could have seen a pump. So with the available IV set, even the IV set which I have shown, it is able to deliver only 60 ml per kg per hour. The dose rate shows you can go up to 90 ml per kg per hour without any problem of pulmonary edema or damage to the animal. So with the available setup in the IV set, what is the human IV set delivering 15 drops per ml, you can give fluid safely in whatsoever condition is there. Within bracket, take care the animal does not have a respiratory problem or aspiration pneumonia like these things. Otherwise, in all the conditions you can give. And many people, you will understand the cardiac problem, you are not going to touch fluid. Frequency, it depends. Morning and evening, if you are free, you can give. It all depends upon your valuable time available. Otherwise, you can pump in the single shot when you are going morning or evening visit.
Another question which has been asked by 5-7 people is there a correlation between heat stress, summer stress to laminitis? Laminitis.
Laminitis, because what happens, there is a good correlation, many papers are there. And then one such factors they explain is the animal is the bicarbonate and another one is the potassium. Animal keeps on standing and these are the factors which going on for laminitis. So one account is you can also think of Rheumatic Acidosis that going for histamine release and that also accounts for laminitis. The another cause for your laminitis or lameness is your potassium, so which is also being lost excessively during heat stress.
Then people are asking which fluid to be used for diarrhea in large animals.
Diarrhea?
In large animals.
Yeah, diarrhea you can use balanced.
Specific?
Yeah, in case of coughs, I have given because most you have to use base deficit bicarbonate. Otherwise, for a cattle, it is very safe. You can go with the multiple electrolyte solutions or Ringer's lactate. In case of cough alone, you have to use bicarbonates because the quantum of bicarbonate cannot be substituted. So use bicarbonate with the normal saline, or else multiple electrolyte solution will be fine with the Ringer's lactate or Intalate.
Another important question which is asked by people is they look at different therapies. So they say that if I do not have sodium bicarbonate, can I use baking soda? So,
can I use
baking soda?
Baking soda orally? Orally?
Yeah. I understand the question is orally. So.
Baking soda we are not supposed to use, but the field condition they are using it. For as a for a buffer for rumen lactoacidosis, if that is for rumen lactoacidosis, best is you can use Gelusil. Maybe whatever preparation is available, you can use Gelusil because what is needed is a oxide, maybe magnesium oxide or aluminum oxide. If that is available, I think any shop will have a basic antacid preparation. Those things you can use for sheep and goat or cattle.
What is a basic difference? There's another question. What is the basic difference between heat stroke and hyperthermia? Heat stroke and hyperthermia. What is the difference?
Actually, we can say these are both are same. Heat stroke is same as hyperthermia. There's other right names. And somebody calling as hyperpyrexia. There is no term called as hyperpyrexia. Pyrexia is pyrexia, elevated temperature in response to a pyrogen. It may be internal or external pyrogen. It is pyrexia. Hyperthermia is elevated temperature. We normally refer to heat stroke. It is because of the environmental cause. Hyperthermia bracket, it is a heat stress.
Dr. Vijay, since it is an INTAS platform organized by INTAS, a frequent question being asked by people is that we use Tribivate along with Intalite for an IV formulation number of times. We have been told not to use liver extracts, but we use vitamin B1, B6 and B12 and it works. And you said that it should not be used. So will it create any adverse effects?
No. The problem is what?
Intalite.
No. That is a good question. Again, put by Dr. Nitin. Once you say in a common platform, mix it. They will mix in all the solutions. They take Intalite, they will mix phosphorus. They will take potassium. The thumb rule, if you give it to the veterinarians, don't mix with electrolyte solution. Do not mix it. The safest is DNS and NS. If you are doing a clear idea, then they will be very clear. Otherwise, they will mix it with everything. So please, if whenever you want to add Tribivate or maybe phosphorus, so you use dextrose normal saline. Okay, there is no harm in mixing with Intalite, but along with Intalite, I think you are going to use DNS also. You can use 500 ml of DNS and then mix Tribivate. There is no harm in doing that. If you see into the quantum of fluid required, I think there is no harm in always using a DNS, safely using all the product. If you are getting carried away by like this, Tribivate in Intalite, then your mind goes like this. Always mix anything with Intalite. To have a cautionary note, so you mix any drug only with DNS or NS. That way, if you are using ceftriaxone or tazobactam, you will have a tendency, because I don't have fluid, I have only Intalite. So you will be mixing it. So the cautionary note, do not mix any drug with electrolyte. Then you will always carry DNS or NS with you, which will be also useful for you flushing of the wound or some other things. So, or maybe reconstituting. For example, sodium bicarbonate is not there, ampule is not there. You can reconstitute with the sodium carbonate, which is sodium bicarbonate available as a powder. That you can mix it with normal saline. So always have a point, normal saline and DNS should be there in your kit, along with all other things, Intalite or your dextrose, everything. So as a cautionary note, do not mix any of the drug with the fluids. Only accepted is NS and D.
There are around 100 questions on, I'll say, blood transfusion. So I'll not put it across because that topic we have not covered. But one basic thing is, when I take a blood, should I mix on something before transferring to another animal? Or no, I can do it directly? Is a one frequent question asked by most of the people. And where should I go ahead with the blood transfusion? In what cases? You want me to repeat?
Yeah, I got it.
Where?
So for blood transfusion, what happens is the main criteria to pronounce the animal as anemia is less than 20. When you want to give blood transfusion, PCV should be less than 12. If the PCV is less than 12, the animal cannot sustain life, so advise blood transfusion. You have to collect blood from a healthy donor and then collect using a blood transfusion bag. Okay, 350 ml or 450 ml bag. But the point to be taken is you always have a three-way adapter. You can cut three-way adapter, cut with the blood transfusion bag where there is a needle attached to it. This prevents multiple pricking of the donor. Okay, once you use it, once you see the three-way adapter, then it becomes anyone can use it. See it and use it. That is what is a simple thing. So instead of multiple pricking, because we may be collecting 8 to 10 bags, so multiple pricking from a donor, it gives an unsightly appearance and then bleeding also. So a single prick, use a three-way adapter for collecting it. And then before doing all this, you have to have a triple drop method. Take a glass lid, keep one drop of anticoagulant, which is available from your blood bag. And then one drop from the donor, one drop from the recipient. Mix it and allow some time, put a cover slip and see it under a microscope. So if there is no agglutination, clumping of the RBCs, you can boldly go for blood transfusion. Then only you should start your collection. So during a transfusion, always use a blood transfusion set. That is to avoid the blood clots. So the blood transfusion set will filter the blood clots if at all if it is there. And then for the first 20 minutes, give slowly, because if at all if there is any reactions, so that will be manifested in the form of wheals or allergic manifestation in the mucocutaneous junction or sometimes a fever. So which you will notice only during the first 20 minutes. So if it is not there, you continue the blood transfusion. Meanwhile, you keep your antihistaminic or adrenaline ready. If there is animal is having the very severe anaphylactic reaction, you have to give this. Otherwise, there is no need of antihistaminic and adrenaline. Keep it safe when you are going to start. When there is no reaction, you continue it. That's a simple method.
Some vets have asked a question. This is one of the webinars where I'm not taking the names because questions look the same. So, can we give steroids or isoflurperidone in heat stress? I will just say actually steroids are the answer for everything, but I'll let Vijay answer that. Can we use isoflurperidone for heat stress?
Heat stress. Don't give that. Yeah, your NSAID, steroid, isoflurperidone do not have any effect on heat stress. Please understand, this is a gradient. There is no gradient occurring between the animal and the environment. Both are in same temperature. Okay, simple analogy is you take a cup of tea and then boil it or make it warm by keeping it in a gas stove. Okay, unless you switch off the gas stove, the tea is going to be hot. Okay, the gas stove is your radiation or whatever is the environment. You have to take the tea cup away so that it gets cooled because of the environment. There should be a gradient. If there is no gradient, then the hyperthermia or the so-called heat stroke going to be there. Remove the cup of tea from the gas stove, keep it away. It gets dissipated from the convection or conduction. Then it becomes cool. Okay, that's why the spraying of the water, physical methods of cooling, which is 22.5% more better than other conduction or convention. So that is the way. So don't use anything. Recommended is pouring of water and then fluid therapy, IV. In fact, you can chill it. You can cool the water and give rectal enema and your Roman lavage. These are the accepted things. And then maybe you can give later stages if the dick is all going to occur. You can give a corticosteroid if you think it is very severe. So then at that stage may be of use.
I will say that I am not able to put forth all the questions because then with Dr. Vijay will go into heat stress. But I'll put yet another question, one or two questions to him. Any change in the blood picture that happens during heat stress? If I'm observing a blood picture of an animal, do I feel or do you have documented any changes in the blood?
Blood picture is not going to give you very pathognomonic lesions or changes. You will see, of course, increase in packed cell volume, total protein, and of course sometimes there will be a neutrophilic stress will be there. And if there is a cortisol rise will be there. Practically, by seeing that, you are not going to account for the etiology. So, because this is a hyperthermia, okay. So, except for increased PCV or total protein, and it is not going to give you a clue for the treatment or the prognosis. So, I don't think blood picture of will be of use.
Vijay, I'll put a last question. Reason being, so that people can also do other works because it's a Sunday, as well as you can do that. So, but I assure people that whatever are your queries which remain unanswered will be answered by Dr. Vijay and will be passed over to you or by mail in the next 1 week or probably 10 days, looking into the scenario, how fast we can do it. Daily, what we'll try to do is we'll try to send 50 comments from his end to you so that we close all your comments by the next 10 days. Another question is that in the field, how do we judge dehydration? To what level? How? How do we judge the percentage of dehydration in the field level with no aids possible, no gadgets possible?
Yeah, no gadget possible. That's why we have put one tabular column. Please go through the tables. The best thing is skin turgor test. Pull the skin in the neck and then leave it. The time taken for the skin to regain is the skin turgor. So how many seconds it takes, you can see on the left side. That will give the percentage of dehydration. Another thing is the mucous membrane, whether it's moist or dry. So moist means you are safe. Dry is the animal is getting worse. Okay, so these the two things are more important. So another important thing is the eyeball, sunken eyeball. The eyeball is kept properly without going deep inside. Animal is fairly normal without dehydration. As it goes deep or sunken eyeball, it is a very bad shape. So in a clinically at field condition, kindly note down whether it's a moist or dry, skin turgor test, and the sunken eyeball. This will give you a clear picture. If you want to still go better, maybe for peripheral circulation, you can take off the capillary refill time and then take your heart rate and pulse respiratory rate to account more for the heat stress or to know about how the cardiovascular function.
Thank you to all. Thank you to Vijay. Whatever remaining questions are there, we'll answer you offline on emails. We thank you all for being.
Thank you so much. Thank you.
Being there, audience strength is 3,026, the ever highest which we have seen in India. So we have crossed the figure of 3,000. We thank you all for this knowledge sharing. We thank Vijay for sharing the knowledge with all his friends and veterinarians. We thank you all for being there. Thank you, Vijay. Thank you all for being there. Thank you. In case anyone has anything, you can still put on to us on mail. We'll come back to you. Thank you.
Thank you. Thank you so much.